Hi, welcome to Barination, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Jason and I are so excited for you to listen and watch this episode. It features Dr. Damon Tanton, the medical director of AdventHealth Central Florida's Metabolic Health Institute. And it's a big one.
Yeah, there's going to be a lot of information about metabolic health, wellness, how it's achieved, what it looks like, pre-op, those types of things. It's going to be an episode you guys are going to start and stop, probably listen to a couple of times, take some notes. And that's awesome. That's exactly what we want you to do. That shows that you're engaged in paying attention and need to know more information about that. It may seem like it's a lot at the beginning, and that's okay. Well, you've got this. And as always, we've got you. If you do come up and find yourself that you have any questions that you want further information on, please reach out and let us know, because that just means we get to have another episode with Dr. Tanton, and that's amazing.
Our mission here at Barination is to connect you with the education that we all need to thrive along our obesity health journey. And this podcast was brought to you by AdventHealth Central Florida. They believe in the education and they believe in supporting patients in every stage of the journey. We're so thankful for our continued partnership with them and are excited to share this episode with you today. Big thank you to AdventHealth Central Florida for making it all happen. All right, friends, let's dive in. Hello, Barination. Welcome back to the show. Today, we are thrilled to be having a very important conversation with Dr. Tanton, AdventHealth Central Florida, director of the Metabolic Health Institute. Dr. Tanton, will you introduce yourself?
Well, hello. I'm glad to join this podcast. I'm Damon Tanton. I'm the executive medical director for the Metabolic Health Institute. I'm an endocrinologist by training, but I focus on obesity medicine. I started my first obesity medicine clinic in 2004, before we had really anything to help patients with. And I've seen a lot of changes over the years, especially in the nature of understanding. I think that's the biggest change we've had.
Obesity medicine wasn't really a thing, or it wasn't a thing that I was exposed to in 2004. And it has come a long way. Thank you to research and medical establishments really pushing to help people who struggle with the disease of obesity. Today's conversation is for you. If you have struggled with your weight for a very long time and just don't know what to do, if you are thinking about onboarding treatment and doing something differently, or if you have already onboarded treatment but are finding it difficult to kind of navigate life after that, this conversation is for you. And it is an important one to have because obesity medicine is going through a major transformation again. And AdventHealth Central Florida is really kind of leading this transformation in the most meaningful ways. So you're going to leave today not only understanding really what the disease of obesity is, why it's a metabolic condition, but you're going to know that treatment is changing in a kind and compassionate way that allows you to address more than your weight. It is about what's going on metabolically with you and finding personalized care and treatment that is going to allow you to regain control of your life. So we're going to dive in.
So, Dr. Tanton, when people hear metabolic health, they often think it's a fancy way to say weight loss. What is it exactly?
Well, Jason, that's a loaded question because when people talk about metabolism or metabolic health, there are many ideas that come to mind depending on your perspective. When I think about metabolic health, I'm thinking about hormones. Like I said at the beginning, I'm an endocrinologist by training. So to me, everything is hormones. And so I look at it from a biochemical, physiologic or pathophysiologic frame. And when I say hormones, there may be, the listeners may be thinking of, what does that mean? the hormones that we look at in obesity are your big hormones that handle the way the food is addressed once you eat it. And not only the way the food is managed, but whether you want the food in the first place. So for me, the biggest hormone by far in obesity is insulin. The vast majority, and when I say vast majority, like 90% of people that come to me with difficulty losing weight is because they're hyperinsulinemic, meaning that their insulin level is higher than it should be. And that sets up an environment, what we call an anabolic environment, where the body, under the influence of insulin, preferentially stores fat. And so, the issue is that if we don't correct the high insulin levels that are circulating, it's very, very difficult for someone to get control of their weight.
And really what I hear you saying is that if you struggle with your weight for a long time and you're trying to tackle it with diet and exercise alone, it's not that you're doing something wrong, right? Eating whole foods or what you may consider quote unquote healthier foods is still important, but your body is programmed to use that energy, to use that food differently. And that programming means that you're going to store more of that energy that you're taking in as fat. And the only way to counteract or counterbalance your body's programming is to onboard medical or surgical treatment. Is that correct?
You heard me correctly. So I think, I was asked this question for another documentary that we were filming. And the question was, what's the biggest misconception that people have about weight or obesity? And I have to say that it's the perception or the assumption that it's behavioral. And we've had this problem for 50 years. We've been blaming the patient. And I say we, the medical establishment, has been blaming the patient and has reduced obesity to just a hand-to-mouth disease. And that couldn't be farther from the truth. And the reason I bring up insulin first is because insulin is the foundation, or hyperinsulinemia or insulin resistance, all the same thing. This is the foundation for how your body deals with the macronutrients. So when you eat, your body has a decision, obviously, to make with respect to what you ate. It can either use that as energy or it can store it as fat. And insulin, especially if it's overproduced, it causes the body to preferentially store it, which is instinctual for the body anyway, because the body loves to store extra energy because the body is always worried about that famine or that unforeseen catastrophe when it would be advantageous for you to be 30 pounds overweight.
Which, as a person, and Jason, I know you shared this with me, who struggled with excess weight forever, I never had this knowledge. I didn't understand insulin. I didn't understand the signals that my body was sending me because, as you said, and I really appreciate you saying this, it's not only the medical community who has been telling us this is a behavioral issue. It is just that big industry, food industry, diet industry, all of these things have what feels like, in a lot of ways, been making a living off of telling us that this is 100% our problem. And we hear you and many of your colleagues saying, this is not a you problem. This is a physiological issue. This is your body's wiring not working or not set up in the way that an effective system is. It's not your fault. But if we don't do anything, if we don't partner up and team up to address this underlying issue, you're going to continue to struggle, and nobody wants that.
Yeah, I couldn't have said it better. One of the philosophical kind of undercurrents of our clinics is that we address the science first. And once we've fixed the physiologic problem, then we can hold you accountable for the decisions. But we can't hold you accountable until we've fixed the problem. And for so long, it's been backwards, right? The assumption when you come in is, oh, you obviously just don't have any willpower, or you obviously are lazy, or you obviously want to be fat, whatever the assumptions are. But after doing this for 20 some odd years and seeing thousands and thousands of patients and gaining better understanding over the years, as to what's causing this, we've realized that it is much more complicated than we like to, or we have traditionally made it out to be.
Well, and it's funny you mentioned that, because as we've had many experts in the community come in and speak, you're the first endocrinologist to come in and speak, and you're already saying things in the first 10 minutes that we've never heard before. We had bariatric surgery to begin with, and I've had two, and I haven't heard most of the stuff that you're saying. So it's good to open it up to, kind of a wider array of experts and talk to them, because you can speak to things that most people can't speak to. So hearing you talk about treating it from, treating the issue first and then worrying about, the us problems is, I believe that needs to be the vision for the future, if it's not already in everybody on everybody's watch list for 26. That's what all we can hope for is to, kind of increase the standard of care around everybody, that like you guys do at Advent. Earlier in 25, Natalie and I got to come down and tour Advent, and it was the most amazing thing that we've ever seen from a medical standpoint. Like the way that you guys do your whole patient care, first person make sure that you're totally involved from, point A to point Z is just phenomenal. And just what we got to see while we were there just blew our minds. And we kept waiting for it to kind of fall off, like the bright and shiny up front, and then it just kind of as you go on, kind of like the brochure stage. The first couple pages look awesome, and then you get to the fine print, and you're like, oh, well, that's a... But there was no there was no fine print. Everything was in bold. It was beautiful. It was amazing. Because we kept asking deeper and deeper questions, trying to, eventually get to something that wasn't going to line up with what everybody was talking about. But it just wasn't there. Like, it was just phenomenal on every level. And the fact that it felt like a resort, and why it felt like a resort and not a hospital, and why, everything was just so patient forward. I felt comfortable being there, and I wasn't even a patient. I was like, this would be awesome. Like, I could check in right now. Like, I don't know what it needs to be worked on, but we can find something. It was just very nice to be in a situation like that, having been through, 2 operations, to see how phenomenal that place runs. It was really awesome.
Well, thank you for those words. We do our best to, we're not perfect, but we do our best to try to put the patient first. I don't know if you spend a lot of time being a patient, but I've had experiences in the past as being the patient, right? And you already feel vulnerable. You already feel overwhelmed, and you already feel judged. And so to take a different approach and to go at this with none of those prejudices, and say, look, we understand there's a lot of reasons why you find yourself in this situation, right? And I'm not going to be the person to judge the steps that had to happen for you to get here. But what I am going to be able to do is tell you what the situation is from a scientific standpoint, tell you what we have to offer you from a scientific standpoint, and then offer you the support with the support in science, right? And then after that, if you want to talk about behavior management and things like that's fine, right? But that is not our focus, because I don't think it's behavioral for the most part. Maybe it's too simplistic, but I think that behavior follows physical cues. So I think it's, physiological, not psychological. And so, like with insulin, for example, there's 100 million Americans, at least, with insulin resistance, right? And you hear insulin resistance all the time. Other names for insulin resistance are metabolic syndrome, prediabetes, polycystic ovarian syndrome. They're all the same thing, right? And insulin resistance is the precursor for what we call diabetes, right? Even though I hate the term diabetes, I think it's an artificial demarcation, but that's another podcast. But it's important to recognize that the majority of diseases, probably 70% of all diseases, are predicated on insulin resistance, because insulin is the most inflammatory hormone that we have, and it's the most anabolic hormone that we have. So when you look at, cardiovascular disease, when you look at cancer, when you look at anxiety, when you look at reproductive problems, the number one reason, number one undercurrent for all of that is hyperinsulinemia, right? That's why when we treat, with these insulin sensitizers, the ones that have become famous, right? Those medications that everybody wants, really, if you boil it down, they're just very robust insulin sensitizers. So if someone loses, let's say someone loses 100 pounds on Ozempic or Mounjaro or Wegovy or Zepbound, and they're holding up the jeans, I lost 100 pounds. That's great. But what that tells me is they were horribly insulin resistant prior to starting the medication. Because if you look at the research around those medications, the typical weight loss is not 100 pounds. It's like 20, 30 pounds, right? Unless you are markedly insulin resistant, and therefore you will respond more, your response will be more amplified because of that insulin resistance. So I think that's a key. I like what you had said earlier before we even started recording, that that the weight is just bonus. It's just that really what I try to get across to patients is to improve the metabolic health is the number one thing that you can do for your health for the next 10, 20 years. You will actually change the trajectory of your health if you change your metabolic health. And so, yes, we see weight loss in the mirror. That's our gauge. But that's not really why I'm trying to get them to do it. Because for me, I'm fulfilled by the fact that their metabolic risk is lowering. They are fulfilled by the fact that they see in the mirror and they get that kind of feedback, right? We both win. The weight loss is the hook that keeps people motivated, but it's not the foundational advantage that we get from these medications.
Yeah, because honestly, like, we go through this and we have these conversations and we talk about metabolic wellness and we talk about how important labs are and all these things and insulin resistance and all that. But I'm going to tell you right now, the scale and the genes fitting better make me happier than reading a lab report. I'm just saying. Nobody's like,
that's right. But I will say, most of my patients now come in and ask me what their insulin level is, rather than what their glucose is, because the insulin parallels their weight. And let me take it one step deeper. Often I'm asked, well, what causes insulin resistance? If we have 100 million people with insulin resistance, how is that happening? And I think the easiest way to kind of simplify it is, if you're looking at a bunch of dominoes, the first domino to fall is fat deposition in the organs, principally liver fat. So what we call visceral fat. But fat in the organs starts that cascade that eventually leads to insulin resistance, eventually leads to overall fat gain and to diabetes and cardiovascular, all that. but it's the visceral fat. So you'll see over the next 10 years, the newest tsunami that's coming is fatty liver, otherwise known as MASH or NASH, or, there's all kinds of names for it, but it's fat in the liver. And you think about it, the liver is very important in handling sugar, keeping sugar normal, glucose. So if the liver gets full of fat, then it doesn't handle sugar very well. So the pancreas says, okay, I can make more insulin to overcome that resistance to keep the sugar normal. And so the insulin goes up. And then, of course, when the insulin goes up, then you start gaining more fat again, because insulin is the most anabolic hormone. And then, of course, at the same time, because it's the most inflammatory hormone, you're getting you have this overall increase in inflammatory undercurrent. And so other things that are inflammatory, which is like everything, gets worse as well. That's why a lot of people, probably most people that lose the weight, especially with the GLP-1s and GIPs, they will tell you how their inflammatory diseases got better as well. Their GI diseases, their arthritis, et cetera, because everything, or not everything, but almost everything is inflammation.
I am so, I know Jason's laughing because this happens often. We hear things from experts on this podcast that absolutely change the trajectory of our lives through treatment. What I am just so thankful for is you very clearly giving us this domino visual, right? Because if you're watching or you're listening to this podcast episode, at some point you have experienced one of these things, and it does feel like a domino cascade that is well out of your control. Because once that first domino falls, chink, 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 other things happen, right? You're in your doctor's office one day and, oh, your cholesterol is higher, or, oh, you're almost in the pre-diabetic level, or, yeah, you've got arthritis. You have something that your doctor has said, this is new, this is wrong. Boom, domino one. And then for your foreseeable future, every time you go into the doctor, it's, oh, now it's this. Oh, now it's this. Oh, now it's this. My quality of life is worse. I'm winded when I try to play with my kids or grandkids, or you just start seeing these things being taken away from you slowly, but you're only listening to the voice that's going on up here, which is telling you it's your fault. It's your fault. It's because you're not moving enough. It's because you're eating wrong. It's because you. And what I hear you saying is that a way to stop the next domino from falling is to make an appointment and to say something's up, right? Something is up. Because what that does, right, is that stops this domino from falling, and it puts in place a whole new set of dominoes. And when you start that treatment, now you're knocking down the dominoes in a positive way. Oh, okay, we're going to get some labs. We're going to understand this. Oh, we're going to teach you why your body is responding this way. We're going to do some education on this insulin and hormones and what's actually happening in your body. But we're going to go ahead and start treatment, even though you might not understand kind of this medical stuff. You're here, we're going to treat you, and it's our job now to educate you and take some of this burden off of you that you've been feeling. So now you're starting a whole new train of dominoes, but it's the train of dominoes you want to be on. It's the one you want to play, because the things falling in place are treatment, are things that are making the most positive difference in your life.
That's a good way to extend the analogy. If we look at disease, especially metabolic disease, it should never, ever be a surprise. Like type 2 diabetes, for example. We can see type 2 diabetes coming for 15 years. Type 1's different. What type 1 is, when the pancreas dies from autoimmunity attack, that's like a tornado. Type 2 diabetes is like a hurricane. You sit there and watch the person on TV tell you the hurricane's coming for 4 days, right? If you're still there when the hurricane gets there, then that's on you, right? So type 2 diabetes, we start seeing what eventually becomes diabetes 10, 15 years before. In the first lab that we see go out is obviously insulin. But even if you don't get an insulin level drawn, the first sign or symptom that tells you that you have insulin resistance is you start having cravings for sweets. You start feeling tired after meals. You start feeling anxious for no reason. You start waking up at 2 o'clock in the morning, completely awake and ready to start the day, even though it's 2 o'clock in the morning, right? All of those are manifestations of insulin dysregulation. And the reason we know that is because of the continuous glucose monitors, the little patches you see people wearing. We've learned a lot about that roller coaster over the years. Like 15 years ago, I started putting type 2 patients on, continuous glucose monitors, and I would see all kinds of dysregulation. And these were people that weren't even on medication, right? So your body is going back and forth. And so if you think about, the ultimate treatment is, like I said, getting the fat out of the organs, because that is what we consider to be pre-inflection point, before the disease, has the spike up, right? So much of our medical system is focused on post-inflection point. After you have disease, you stumble into the hospital, and we have a way to patch you up. But isn't that so backwards? And especially in terms of obesity, is so backwards. We wait until a patient is 100 pounds overweight. We say, hey, you probably should do something about this. No. You should have done something about it 10 years ago. And I don't mean you, the patient. I mean the medical system should have done something about it 10 years ago.
Jason and I are nodding here in agreement. We have both been in this position in a doctor's office, and the treatment that was offered for our escalating metabolic issues was not metabolic and bariatric surgery, and the GLP-1 medications, where it was a different version back then. What I'm hearing you say, and what AdventHealth Central Florida is doing, is you're saying no more. We are not going to continue to treat this disease and these other metabolic symptoms and syndromes in the way that we have before. We need to get people continuous care immediately, and we need to take some of that burden off of them. Because just like what you were saying, right? I suffered for 25 years as a young adult into adulthood with the things that you're talking about, and was never spoken to or offered any type of obesity treatment or education. Never. And I feel like in this day and age, it's not acceptable anymore, because even though obesity has been, right, this rising issue for Americans and throughout the world for over a decade now, whatever we've tried in the past isn't working. So I see AdventHealth Central Florida, you and your other practitioners going, this is not working. We need to pivot. We need to address this disease head on, and we need to give people who are suffering a very low barrier to entry, so to speak, right? If you have these things, if you're noticing this, you are a candidate for treatment, and here's where you start. That's a powerful shift.
Yeah, and it's long overdue, right? So it's important that every patient, or every person, let's say that, every person that struggles with this has something that they could benefit from the medical system. But most patients who are struggling with weight, guess when they enter the system? When the system offers them surgery, right? And don't get me wrong, I'm a huge advocate of surgery, right? But it's one of the many services and options that we have, and it's along the spectrum, or the continuum of care, right? Because we have patients that come in that all that they end up getting from us is some education, which is great, right? And then we have obviously those that have, get medications, and then we have obviously all the way up to endobariatrics and bariatric surgery. So it's the whole spectrum, and that's why we put bariatric surgery in the Metabolic Health Institute, right? So we have close to 50 clinicians in the Metabolic Health Institute. About 35 of them are endocrine related. About 10 of them are bariatric surgery related. And then we have a few that are what we call health optimization clinic. That's kind of the glue that holds it all together, right? We end up looking at this as one disease, right? It's not a surgical disease. It's not a medical disease, behavioral disease. It's one disease, and it needs to be addressed from a variety of angles. And not every person or patient responds to a specific angle equally.
Why is now the time for personalized, individualized care?
The personalization of care is one of those things that you would think that we as patients or consumers, even though I don't like the word consumers for healthcare, but that we would have demanded by now, right? Because we demand personalization in every other facet of our lives, right? When it comes to healthcare, for some reason, we've been just okay with everything being the same, right? And I mean okay, meaning that collectively we've been okay because we haven't changed it, right? I know that individually we're all a little bit frustrated and disappointed with the way that healthcare is rendered, right? Mm-hmm. But collectively, it hasn't been enough to change the overall tenor of healthcare. We're trying to change that narrative to where patients that come in to see us are a one of one, right? They're not a type. They're an individual. We have certain principles that apply to the majority of people. I mean, that's just science, right? But everyone is an individual. And so I think that the more that healthcare systems will embrace this, the more business they'll have, right? Mm-hmm. And, unfortunately, it's difficult at scale, right? So anything is easy. If you have a small little clinic and you see 20 patients a day, I mean, of course, you can be as personalized as you want to be, right? Mm-hmm. The difficulty comes when you're talking about like AdventHealth, 50 plus hospitals in 11 states and, seeing millions of patients. So in order to change that, you have to actually change the fundamental philosophy underneath the healthcare, right? Because you can't change every clinic individually. You have to change the mantra, what's behind it, right? And so that's when I hire clinicians for the Metabolic Health Institute, I'm really keen on their philosophy towards patients. If I don't like any paternalism or authoritarianism or having kind of a judgmental kind of me-centered. I'm not okay with that, right? So it's part of it is changing the clinicians as well, and I can say that because I am one. We need to change the way that we see patients and disease because there's way too much judgment going on in the clinic.
Well, and when you spoke about that earlier, you were talking about how, the first thing coming in, it's like you discussed not the patient-centered issues, but the actual metabolic issues. So that it's, because so many people you walk in and they're like, oh, well, you need to lose weight before we can even have a consultation. Or you need to do this before we can even have surgery. You need to do this before this. And it really does, it takes enough for a patient just to admit that they need help anyway. So to come in and walk in and be blindsided by that type of behavior, that's the standard of care that we as patients want to see change, because I know we've heard stories from countless number of people that just felt like they weren't treated fairly, weren't treated like people. They were treated like, numbers. They were treated like the next check. They were treated like however you want to put it. Yeah. But it was so demeaning in such a way. Like I finally got myself up got the courage up to ask for help, and this is how I was treated. I was treated no better by them than I am society on a daily basis. And having, the medical judgment is way worse than, societal judgment, because you're looking for, you got a handout asking for help, and they're just like, but, April went through this too. A lot of times she talked about it like, you're just big. If you just lose some of that weight, everything will be fine. We'll fix all your problems. You drop some of that weight. And then you come to find out like, oh, you mean that didn't help? That didn't fix it all? Oh, shucks, gee. But now we have to really work and figure out what the problem is. But that judgment is just it's really hard.
It is terrible. And I'll go one step further. It's arrogant. When you are judging someone that's coming to you for help, that, like I said before, is vulnerable, and you choose to take that moment to pass judgment on them, is pretty arrogant, first of all, and it's pretty hypocritical, because I don't know about you guys, but most of the doctors that I see walking around, they're not perfect specimens for help. And, I tell my patients the best physical cue that you might be having metabolic issues is the flatness of your stomach. So all you have to do, you don't have to get fancy insulin levels and scans and everything. Just look down. And if your stomach is not flat, then you likely have some fat in your liver, right? The reason I say that in this segment is, guess what? When I look down, my stomach's not completely flat. So how can I pass judgment on you and say, hey, you need to eat less and exercise more, and why you want to be fat? And then I look down and I think I have some fat here. So it's a very arrogant stance, and I think we need to start eliminating it from our medical system.
That's a good test to look down and do that, because mine is flat, but the L is silent. So it's like that, but it's not like that.
It's flat.
The L is really silent in mine. So there's some liver going on there.
Oh my God. Dying in the best way. I mean, our mission here is to support people with humor, humility, and honesty. And we've checked all three of those boxes off with this conversation.
Yeah.
And you know what I thought? And Jason, I think you and I were mind melding about this. We are both post-op bariatric patients. Jason's had revision. I've had one. And we both went into surgery thinking, oh, this is it. This is going to be the thing that helps with all of these other things. And pretty quickly on in our journey, we realized, oh, yeah, no, this is not going to be the only thing. Jason and I both continue to have health issues related to metabolic syndrome, right? Our disease of obesity continues to function in our lives. We've onboarded multiple forms of treatment, and we are light years healthier than when we first embarked on this journey. What I hear you saying, Dr. Tanton, is initial treatment is where we start. Ongoing treatment is how we really work to give you your life back at every stage of this disease. And as we age, the disease ages with us. And it is really important to have a care team that is looking at you as a whole person, not as a singular issue within. Because as we know, the disease of obesity impacts every facet of our life. You've described this beautifully, right? It impacts us metabolically in so many different ways. And you really do need that team that can look at your disease, not only from you as the individual, but from how the disease is operating and impacting your life. You could require 50 different things, whereas somebody else might require 10. But if you don't have a team that is looking at you as a whole person, as this holistic being to support, you could be missing out on a lot of things that you really need to be well.
I couldn't agree more. I think that the reason that, well, there's a couple of reasons, but the main reason that most medical systems don't focus on whole person care is it's very hard to do. Because it's much easier to see a patient as a disease, right? Because a disease has a specific, algorithm of treatment. You say this disease A is treated with medication X or surgery Y, and it's very cut and dried, right? But life's messy, right? And people are not just diseases. There's a lot more that is involved. And so to take on whole person care is a big undertaking. I mean, and so you need a big team, a dedicated team, to be able to do it, because that's the reason why surgery is not the only treatment, but it's a tool in the toolbox, right? Because it does help to reverse some of the physiologic or pathophysiologic derangements, but it doesn't address any of the other non-surgical issues, right? For example, when someone undergoes bariatric surgery, let's say they have a Roux-en-Y procedure, there's nothing that lowers the insulin quicker than bariatric surgery. Like, you could have an insulin that was 12, 15 times normal, and you go in, have the surgery, and before you've lost any weight, the insulin goes to normal. So yes, you correct some of that initially, right? And then you have adaptation, where the body starts to adapt back to where it was before. And I'm often asked, especially by patients that are either bariatric surgery, but more the patients that are on the GLP-1s or GIPs, they're like, well, I've lost 80 pounds. Can I come off of these, and will I have to restart? And the answer is, I don't know, because everyone's different. I've had some patients that the body resets this equilibrium point for insulin resistance. They come off the Ozempic or whatever, and they never move back. That the body just stays there. I've got others that they come off and then they start inching right back up, on not just on the weight, but on the insulin level. And so it really depends on the physiology. It depends on the history. It depends on how your body composition, how much yo-yo dieting you've done all kinds of things are involved. But the bottom line is, it's not so simple. It's not like the public wants to make it out to be, that if you have bariatric surgery, or if you lose 100 pounds with Mounjaro, that you are good to go until you die.
I think this is one of the main reasons that people struggle to onboard care, or they struggle to continue to seek care. I've experienced weight recurrence. I've experienced some numbers ticking up after surgery. Jason experienced it on a lot of different levels too. And that shame that we can feel around, right, the weight recurring is so overpowering that it can stop us in our tracks for continuing to onboard care and treatment. And it's devastating when you have done so much work, when you've taken such measures to treat something, only to realize, I feel like, or I kind of am right back where I started. That isolation, that shame feels just like it felt in the years that it took you to walk into, right, that doctor's appointment in the first place. But what I hear in this new model that AdventHealth Central Florida is really working to pioneer is you're closing the gap, or you're really working hard to eliminate that shame, so that people are staying engaged with their care for their lifetime, not just for that singular moment that they make that decision to onboard. Because, I mean, we also know people think that bariatric surgery or weight loss is something cosmetic, and you feel guilty about that, right? You feel like, oh, well, if I lose a bunch of weight, people are just going to think I did it because I want to look different, or I want to look a certain way in an outfit or a bathing suit. But it's not cosmetic at all. Excess weight is the outward sign that you have something really serious going on the inside. And if you keep letting that shame or that blame to prevent you from doing this, you're only going to continue to deteriorate internally and cut your life short.
Yeah, that's pretty deep. I think, shame is not something we talk about a lot, and I think, for obvious reasons, right? But it has no place in medicine. it's the same tired story. Whether people, are addressing other, alcoholism or drug abuse, or, they always want to blame the patient, right? And not look at potentially reasons why they're susceptible to certain disease patterns, right? And I've been guilty of that when I started. When I was a young doctor, I was kind of like, come on, this is all reversible. You just need to be more dedicated. But that was 25 years ago, right? Where I was immature. I was I had been taught that way in medical school and or at least implicitly in medical school and residency and fellowship. And it was, kind of at that time it was, the doctor is going to swoop in, and fix your deficiencies. Right. And so that kind of plays into that, arrogance, right?
I feel a sports metaphor here. There's a commercial, and I don't know what commercial it is, right? But it's somebody is doing something and they're messing it up, and their friend, their partner, their spouse is like, all right, you're out. I'm bringing in the bench, right? Like I'm bringing in you. Oh, yeah. But like to go back to the thing that we were talking about a little bit earlier, why is it so difficult asking for personalized care now? Well, it's certainly a modern thing, right? To personalize everything in your life. But when you have been told and when you have internalized the statement that this is all your fault and you do not deserve treatment, let alone you don't deserve personalized treatment, then it's a big ask. And it's a big ask for everybody, not just for practitioners and practices and systems to make this holistic shift. But you're asking a lot of patients to kind of embrace a new mindset of, oh, maybe this really isn't 100% my fault. Maybe I do deserve some personalization of care. That's a really hard ship to turn around, but we see you doing it.
Well, I think that, there's a trust issue also, right? Because, some of the most difficult patient interactions I've had is with patients that have had difficult interactions with others in the medical field in the past, right? Because they come in with this distrust, this, kind of a defensiveness edge, and part of the first half of the visit is breaking down those barriers, or trying to, right? Because all of that they have received from the medical community in the past has been judgment, and disappointment. And so I think it'll take some time, because yes, patients need to change their mindset, but it's not that easy. You can't just switch on a mindset. You have to be reinforced by a different system and not be disappointed yet again when you come in vulnerable and get an experience that is deflating. Yeah.
Well, and they probably come in with their list of red flags and things that they're not going to allow to happen again. And that, that wall you
That's right.
down, they're like, oh, I'm not going to put up with this and I'm not going to stand for this. But it's understandable because like you said, they come from, years and years of feeling that way and being that way and being treated that way and judged and treated in such a way that it's just not comfortable to be in that setting. And the white coat syndrome thing is real. Like when I first met with my original bariatric surgeon, he's like, what surgery you want to have? And I'm like, not my job. I don't know. What the hell do I know? I was like, I didn't even stay at a Holiday Inn Express last night. I couldn't even play doctor. I don't even have my white coat. Like I left mine in the laundry. But, and that's just kind of the thing. Like we look at it as such the pedestal is never going to go away with, and with good reason for the most part. You guys do what you guys do to be the best that you are. But it's just like you said, like aging out of the practice is something that really I think needs to be looked at because it really is a thing. Like I talked to one of my really good friends that's looking to have surgery, and he went to his primary care doctor, and they were like, "Well, that's not going to do anything for you." What do you mean it's not going to do anything for you? What are you talking about? Like bariatric surgery is not for you. Like that doesn't even work. And I was like, what? I was like, oh, okay, that's cool. But the sad thing is you hear that a lot from primary care doctors who just don't believe in it. They're just flat like, nah. And then, that gets the conspiracy wheels turning and everybody's like, well, is the sick model thing real? And is that really what we're doing? And, why don't we want to do, why would you not push someone? Because my primary care doctor I was sitting in front of her like, I don't think that's for me. I don't weigh 600 pounds yet. And she was like, you don't think it's for you? Like, she didn't like,
she was the opposite. No,
right. Yeah. She didn't like I was sitting there trying to fool myself. Like my blood type wasn't chocolate milk at the time. Cause I was 458 pounds. Like I was big as could get. Like I'm the biggest person that's ever been in my family. So for me to sit there and be like, yeah, but I don't weigh 600 pounds yet. She's like, yeah, you're not going to make it there. I hate to break it to you. But at 44 years old, you're actively dying. And if you don't do something, like this is going to get, there's not going to be anything to treat because you're not going to be here. So to go from hearing that to hearing other doctors that are just like, yeah, that doesn't work. And I'm like, luckily I didn't have one of those because I would have believed it. I would have hook, line, and sinker. Been like, oh, well, it's not for me then. Like, if it doesn't work, I just would have gone on just jolly as can be, thinking it was that's how life was supposed to be.
Well, it's so important that you, and everybody has their own process, but it's so important that you address these issues early because, of course, it's harder, to walk it back, right? Like, and so I think that in your case, you had a primary care physician that cared about you and that was knowledgeable enough to be honest with you. I wish somebody had been honest with you about 200 pounds earlier, but better late than never, right? And so I think, it's everybody has their own process and timing. But I think, that's the reason I wear my memento mori ring. Basically, I believe that we're always dying, right? And that's not a morbid thing. The fact that we are continually dying makes every day more meaningful, right? If there's not a contrast of death, then life really doesn't mean anything, right? So I wear this to remind myself. I also have a matching pendant, and part of it is because I want to look like a tough biker, but really it's something philosophical. But it applies here, right? Because, time is always ticking away. And I don't mean that in a depressing way, but there's no better time than now to address the issues. And the earlier that you address them, the easier that we can make meaningful change.
I am so thankful that you said that because it is true. We are aging every day. And every day that we live our life untreated is a day that we are not accessing the fullest life that is available to us. And for too long, millions and millions and millions of people have stopped themselves from taking that next step, which is getting care. And we understand that it can be a little bit challenging discerning what care is right for you. As you said, right? Every doctor, every clinician can have a different philosophy. But I think what our hope is with this conversation is that if you're watching or you're listening, that there are different practices, there are different systems, there are different options out there for you. And now is the time to do something differently. Now is the time to think about what is happening on the inside, to give yourself a pause from thinking about the weight and think about your organs. Think about what your body is doing every day to help you fight something that is out of your control. There is no reason to wait for that any longer, especially when you have a metabolic health institute like what AdventHealth Central Florida is building. You have it there. And not only do you have it there, but you have one phone call to make, and then you are met with kind, compassionate, whole person care that is going to walk you through everything. You don't have to know all the answers. You don't need to know what everything means. You don't need to know all the specialties. You just need to know how to pick up a phone or send an email and say, I'm ready. I'm ready to do this differently. I'm ready to explore my health differently, because you want your full life. You're not living your full life. And that's frustrating. And just like yes, that's a reminder. You're not living your full life. And Jason and I and thousands of other people who are part of our Barination world have experienced access to more of our full life. And that's why we do this podcast. It's why we talk with people like you. It's why we host the membership community. Everybody deserves the access to their full life. And the world needs your full attention and presence. The world needs the best version of you. And the disease of obesity and metabolic syndrome, it is taking the best version away from the world. And we can't have that happen any longer.
I'll tell you what, you didn't think that this was going to be philosophical, did you?
Actually, we did. This is usually where our conversations go,
okay,
correct, Jason?
Yeah. But yeah, I mean, it's, with bariatric surgery, right? It's often the question is, when's the right time to have there is a time urgency. So, I always say that it's not the first option, but it definitely should not be the last, right? Because when you wait too long, your pancreas is burned out and you're past the point of no return, and you don't have any, reversibility, right? But everybody's timing is different, but everybody's timing for doing something should be now, whether that's, whether it's picking up the phone, whether it's, getting educated, caring, self-care, right? Sometimes, I've been guilty of this, getting to this kind of vortex of like, no self-care. And all of a sudden you're like, ugh. And that's when I look down, Jason, and I say, my belly is getting big. I better, I better have more self-care or else I'll be in trouble.
Well, I tell people, like, when you were talking about the philosophical side of things, like, I tell people all the time, like, the life that I've gained from the pounds that I've lost is just, it's phenomenal. I could not have asked for a better result from being metabolically well than it is the activity that I've been able to perform in the life that I've been able to live.
I really like that. So let's say it again, the life
I've gained from the weight that I've lost.
Yeah. It's when I see patients, I still see some clinic, and, I see about, half a week I see clinic and half I'm doing all the other medical director, duties. But, there's nothing better to start a clinic by having a couple of patients at the beginning that have lost, 60, 70, 80 pounds, not because strictly the weight, but because of the way that it has transformed them, not just physically, but the whole person. And we're talking whole person care. The whole personality changes. The way they interact with me changes. There's a light that's on now, after they've lost the weight. And so, that's fulfilling. That's why I still do clinic this far into my career, is because that is something that truly is meaningful.
It's hope. We talk about this all the time in the Barination community and on this platform. When you treat the disease of obesity, you get access to hope again. And you have to have a tiny little shred of hope when you make that initial appointment or when you start this journey. Hope is what drives you to do those things. But as you move throughout your treatment journey, you access more and more hope. And that hope is what can help change your behavior, change your mindset, change your actions. It propels everything. Jason, earlier in this conversation, you had said something so true and so profound. And I want to connect it to what we've been talking about today. You had said, I'm not going to lie, it's pretty exciting when you pull on clothes and they fit differently and you lose weight. That is a part of it. And that is going to be the thing that will motivate you to keep going in the short term. But what I've seen, and I'm gonna love on you here a little bit, Jason, what I've seen you go through, especially after your revision, is you talk less and less about your size and shape. And you talk more and more about what you're able to do in the gym and what you're able to do with your kids and how you're able to be present and show up. Yeah, your size and shape, yep, that's one thing. But to see you become more metabolically aware, more metabolically active, and more present, that's really what keeps you keeping on those hard days. It's not your size and your shape. And it's okay if it is in the beginning, and it's okay if it is forever. But I've seen this shift, and it's It's what we're really talking about today.
Yeah, no, absolutely. And it really has changed. I mean, it's changed everything, like astronomically changed. Everything about, like, I tell people that the new lease on life and how that thing works, like, I'm taking full advantage of it because it wasn't promised to me. Like, people are asking me how I feel about turning 50 in February. And it used to be something that I'd freak out about. Now, since 50 wasn't promised to me, 50 was really almost taken away from me. I love it now because it wasn't an option before. Now I don't know. But now I'm like, this is amazing that I even get the opportunity to do this because it almost wasn't the case. And to see my grandbabies grow up, to be able to play with my grandbabies, to be able to run and chase and do the things and get down on the floor and put stuff together and get back, I can do things. And even still, it's funny because I catch myself, I will do something and I'll be like, oh, damn, like I just did. Oh, okay, cool. And I don't think about it. Like I'll get down at, like I was doing a plank and squat challenge with some people on TikTok the other day. And I got down to do a plank and I did a 1.5-minute plank. And then I just stood right back up and I was like, oh, well, that was easy. And it's just, it's stuff like that.
Yeah,
You just don't think about.
Yeah, it's one of those things that those that haven't had that history wouldn't understand necessarily, right? Like, for example, we had one of our patients that underwent bariatric surgery that was, I can't remember, I think it was 650 pounds before he underwent Roux-en-Y, and he's lost 300 pounds, right? And, I remember trying to convince him to go get the surgery in the first place. And it was like a year-long kind of thing, right? But now that he has lost the weight, it's not necessarily the weight he's talking about. It's the fact that now he can ride the rides at Disney that he wanted to ride, that he can, do. I have another patient that when he lost a considerable amount of weight, he finally learned how to swim. Well, why? Why did he not know how to swim? Because he grew up in England and he was embarrassed to take his shirt off and go take swimming lessons, right? So it's just these things that you don't realize. If you haven't dealt with it personally, you don't realize it. But I do realize it vicariously through some of my patients.
We are constantly amazed at what we gain when we lose. We gain the life that we've always wanted. And we understand how challenging, scary, intimidating, whatever word you want to use, it is to pick up that phone or to send that email. But our wish for you this year in this moment is that after this conversation, that's what you do. You do it scared, you do it worried, you do it wondering, but you do it. Because what's going to be on the other side of that email or phone call is Dr. Tanton's team. It is going to be the place that you can really tap into that whole person care, no matter where you are in your health journey. If you're thinking that maybe, if you look down and you see your stomach's a little around, right? If you have been asking yourself, I don't know, I haven't been able to, yes. The answer is yes, you need to make that phone call. If you are absolutely struggling because you've onboarded treatment and you notice the disease is progressing and you're so worried or you're scared or you're living in shame, this is your sign. This is your sign. Stop waiting, start doing. Because there are kind, compassionate, empathetic practitioners that want to help you access your life that's ahead of you. But you have to make the first move. You have to make the first move. Call, email, do it. Do it for you. Do it for us. Do it for the world. It's what is needed right now. Dr. Tanton, as always, this conversation went in directions that we didn't quite anticipate, but it was certainly a direction that people needed to hear. What are you hoping our friends listening and watching are leaving this conversation with today?
I'm hoping that they gained some understanding that that even doctors don't know everything, and that if you think about the way that this is developed over time, right? We've gone from a purely blame paradigm to an acceptance paradigm, and that's beautiful. But that would not be very impactful if you didn't also have action that could help turn it around, right? So during this 25 years where we've gained acceptance and we've gained a different perspective on obesity, we've also gained a lot of tools, right? And so when Jason talks about turning 50, I don't know if he's turned 50 yet, but let me tell you what happens when you turn 50. You start to realize, and maybe some people realize this a lot earlier, but you start to realize that life's too short to not live an authentic life. And so you don't care as much about what people think about you. It's more about what you think about yourself and how you can grow as a person. And so, if weight or metabolic disease is holding you back from being authentic, then I can't think of anything more rewarding than taking that first step, because you allow yourself to be your fullest, right? And that's what you were talking about, is by losing, you gained, right? And so, I not to get too philosophical at the end here, but I do believe that I have become more authentic as I've aged, and I think everybody should strive to gain that authenticity. But it's sure a lot easier to be authentic when you're not dealing with huge health issues, right? And so, if there's one thing that you can do to a gift for yourself, it's to address the metabolic disease, because all of us have some level of metabolic disease, at least 100 million of us. And so why not? Even if you have just a little bit of excess weight, address it now. If you have an unbelievable amount of excess weight, address it now, right? I mean, because otherwise, you're not going to be able to be as authentic as you could be.
We could have said it better ourselves. Dr. Tanton, thank you so much for your time today. Thank you for leading the transformation that we're seeing in the obesity medicine and whole person care. It really is exciting. It's empowering. And we are very thankful to be able to help you spread the word, because this is the care and the treatment that people need and deserve now. So thank you.
Well, thank you for the platform, and I hope you can find a couple of decent sound bites in this interview.
It's called the entire episode. There's no... Yeah.
Okay, yeah.
Thank you, friends, for tuning in. And I do want to let you know, if you are feeling inspired because of this conversation, but you're a little bit nervous, reach out to us so we can be that one that's just encouraging you, right? Over the virtual space. We're there to say, you can do it. You can do it scared. You can do it nervous. We are here for you. We know sometimes you need that little extra support, and that's why Barination exists. So thank you, friends, and let us know if this episode resonated with you. All right, Dr. Tanton.
All right, see you.
That wraps up another empowering episode of the Barination podcast. If you enjoyed today's episode, keep the conversation going by joining the Barination membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.